Hi everyone, today we are doing a neurotoxin treatment, so I'm going to be walking you through marking up as well as injecting. So at the beginning there, you saw that I was palpating over the patient's temporalis muscle. This patient has been getting frequent neurotoxin treatment for the past few years, so now when she activates her frontalis and raises up her eyebrows, it's a little bit more difficult to see where that frontalis starts to taper off. So a nice anatomical location to make sure that you're staying within that frontalis is finding that temporal fusion line. So that's what I was doing at the beginning. Once I have my lateral borders marked, I go in and fill in my injection points accordingly. For the glabella, I like to mark off the ends of my corrugators, and you can kind of see here where she's pulling strong. Again, she's been getting frequent treatment, so it's not as noticeable as it would be on someone who has not. So just marking my corrugators as well as procera. Moving on to the orbicularis oculi muscle or crow's feet, I feel where that orbital rim is and then go ahead and just roll out my finger. So a millimeter or so outside of that orbital rim is typically where I like to place my injections. And then going in and feeling where she's pulling the strongest with her orbicularis oculi here for a brow lift. Starting up on our frontalis, I am just moving from one side to the other. You know, every different injector is going to have a different way that they like to go about injecting. I just like to go from one lateral side to the other, but it really does not matter as long as we're covering the entirety of the muscle. If you were to not go laterally enough, that is when patients end up with spocked brows, just where they're having muscle recruitment. So it's very important, especially when you're new to injecting, to ensure that you are covering that entire muscle and not leaving any fibers untreated. Even though they're, very even to start, once some muscles are treated or some fibers are treated and others aren't, that's when we start to see that recruitment and we can end up seeing a spocked brow. Now we are going into the glabella. I just do a pinch and hold and go ahead and inject. It is important when we're treating our corrugators that we are watching our depth. Right underneath our corrugators is portions of the frontalis, so I like to ensure that I'm pinching and holding that muscle in between my fingers and watching my needle depth as I'm injecting. Like I said, we don't want to be too deep, otherwise we risk hitting those fibers of the frontalis and we can cause the patient to have a brow drop, so we definitely want to make sure we're not causing any sort of ptosis. Going in with our brow lift, I treat very superficial for the brow lift and I place my finger right under that orbital rim just to ensure that I am in the orbicularis oculi muscle. And going in with my crow's feet, my needle is slightly more superficial. And here we are always treating away from the eye and just following along that muscle. Same for the other side. Again, just following along my injection points. We're a few millimeters, like I said, outside of that orbital rim, and always injecting away from the eye. Just cleaning the patient up, I just like to wipe up and away. Very light pressure, I don't want to risk moving any of that product around. Aftercare for a neurotoxin patient is just to avoid touching that area for 4 hours and avoid heat